In this video, we're going to be looking at a patient with anterior cruciate ligament rupture, particularly to look for some of the injuries that are often associated with this and that are easy to overlook if not specifically sought. Firstly, the anterior cruciate ligament injury itself is very easy to identify on the sagittal image. It's quite useful to correlate the coronal and axial images with the sagittal, in particular looking for this bare area on the lateral femoral condyle where the anterior cruciate ligament normally attaches. So the presence of this bare area is useful confirmation of ACL rupture. Medial collateral ligaments are often associated. In this case, the ligament on the coronal images initially looks pretty normal, perhaps a little bit thickened in its proximal part. But on the axial images, we can see that whilst the posterior part is intact, extending into the posterior oblique ligament, there is an injury with soft tissue edema at the anterior margin where it attaches to the medial patellofemoral ligament. And this is a very common area for the ligament to be injured. One of the important injuries to look for in association with anterior cruciate ligament injuries are longitudinal tears of both the medial and lateral meniscus. And here is an example of a longitudinal tear of the medial meniscus. If we zoom in on that, we can see that the tear is orientated longitudinally with respect to the meniscus, and we can see that it's quite far towards the periphery of the meniscus, isolating a small meniscal fragment and the meniscal attachment tissues just outside it. So this is a very typical appearance of a longitudinal tear. But because the bulk of the meniscus looks normal, it's easy to overlook. These injuries do lie within the so-called red zone or vascularized portion of the meniscus, so they may heal themselves, but they can also be unstable and require treatment. These lesions are also sometimes referred to as ramp lesions. So this is an anterior cruciate ligament rupture and associated with an injury to the medial collateral ligament where it connects with the medial patellofemoral ligament and with a longitudinal tear of the medial meniscus.